At this point, we will hear from.
كل واحد give me a mic.
Okay.
That's the only, I think.
Okay. I hope a statement my brother Abdullah said, which is a united effort will help a lot of people. I hope that's what comes out of this meeting tonight, and I hope that's what we all came together tonight. So at this point, Saeed Abdi and Mr. Gina Merrill, right? Really got together.
Assalamu alaikum. Thank you very, very much for coming to this Ramadan Day, organizing this meeting. We really appreciate it. Brother Abdul Roble, Brother Abdini, Abdullah Yusuf, each one of you, and also Sister Rhoda, who played vital role, who called us and contacted us and asked us what we're doing, what we're delivering in Somalia, how we're helping, what we're doing in the US and around the world. But before I jump into what we do on the ground, in which I'll show to you some of the pictures and what we do in the reality, and our team on the ground, I'll just give a chance Jenna to explain about what A.R.C, what they do A.R.C in general, where they work, and where they work right now in Somalia.
Stand up to it. Let me know if you guys can hear me or if I'm talking too soft. But I'm absolutely honored to be here tonight, and we thank you so much for taking the time to listen to us. And you know, it's everybody has busy schedules, and I know that you guys are beyond committed and beyond passionate about what you're doing. And I just wanted to take a minute to let you know who we are. We're American Refugee Committee, so we're an international relief organization that's been around for 30 years. So we started in 1978, 1979, and it actually started with a businessman on the Thai-Cambodian border. And so there were a number of refugees that were fleeing at that point, and he, along with a group of other doctors and nurses, responded to the crisis. It was just a small team of people, and you can imagine a small team of people can only do so much with tens of thousands of refugees that are fleeing and suffering. But the unimaginable happened, and so what they did is they empowered people to respond and to help themselves, especially through medical care. And that was like their initial response. It wasn't meant to turn into this large international organization. What it was meant to be is a chance for them to help other people that needed it tremendously at that point, at that time in their lives. And out of that, they saw that actually a few people can do an amazing amount of help and an amazing amount of work. And so it grew into this organization that spread throughout the world. And so we work in places like Darfur, Uganda, Rwanda, Sierra Leone, Liberia, Thailand, Pakistan. And we're working with people who are at probably the biggest point of struggle in their lives. You know, some people have been living in refugee camps for 10, 20, 30 years in Thailand. Other people have only been there for a couple days, depending on where they are. And the point of the organization and what we do with people is meeting them where they're at. So depending on the context, depending on where we're working, that's how we help them. So if it's healthcare, water and sanitation, in Pakistan when the floods came in, helping people to have homes, helping people to get their livestock back, agriculture, helping farmers plant the fields again. We do things like seed fairs, helping collective organized farmers distribute their seeds so that everybody in the town and in that area can survive together. And so it's really about using creative responses to work with people and to not just say, come into a community and say, we think you need blankets, we think you need tents, we also think you should probably need healthcare and education. It's about coming to people and meeting them on their terms and saying, what do you need? What's your biggest struggle right now? What's going to get you from today to tomorrow? But not just to tomorrow, what happens in a few years from now? And what do we need to do to help you to be there? How do we help you to restore some dignity in your life? And so that that's been happening over 30 years, so it's a long time. I actually just came on to work with the organization about 3 years ago. And I've had the amazing fortune to be able to see the organization go through this incredible amount of growth. And I don't mean size-wise, I mean understanding, awareness, and being able to work with people, not just overseas, but also here. And so 2 years ago, our president, Daniel Wordsworth, this new president, comes in, and he's got this vision, where he thinks that there is a wealth of energy, financial contributions, but more energy and talent that we haven't accessed here in the U.S. and around the world. And what he was saying is that, our programs are the heart of who we are as an organization, but why shouldn't the people that we work with here just as much be a part of that heart and what we have and what we're capable of bringing to people around the world? And so it was a really confusing vision. What does that mean? What does that look like? How do you exercise the talent and the energy of people here locally in a way that makes a direct impact on lives of people around the world? And so we're like, how do you operationalize this? In real terms, how do you make that real? And so he was on PBS, I think it was, wasn't it? NPR. He was on NPR, and so he's sharing this vision in an interview on NPR. And he's saying, I think that there's just as many people here that are willing to commit their time and energy and their talent to helping people around the world. And then they're asking him, well, where in the world should you be that you're not currently? And he said, Somalia. Absolutely. And so then he goes back to his office, and all of a sudden he starts getting these phone calls from the Somali Minnesotan community saying, well, why aren't you? Why aren't you working in Somalia? You were in the 90s. What happened? Why aren't you there now? And he said, well, okay, if we're going to work in Somalia, we're only going to do this in total partnership with you. You have the heart, the energy. Let's pair that with our expertise, our background, and make a greater difference. And so one of those persons, people that call Daniel, this guy right here. And I'll let you talk about that.
Thank you, Jen. Thank you. It was actually in 2009, on the Daniel, who's the CEO of the organization, was talking on the radio, NPR, Minnesota Public Radio. He was asking the question about where A.R.C should have been and not right now there. And he said it's Somalia. And he was asking why. And he said Somalia is the worst humanitarian crisis in the world. One of the worst humanitarian crises in the world is in Somalia. At that time, there was an issue about Haiti. Haiti came in 2010 and was big. But Somalia has been number one humanitarian crisis for 12 years, and the international community didn't give enough attention to Somalia. And after listening, I was driving in my car, and I said, okay, I'm a news guy. I was working for the Voice of America Somali section, and I was working in CFP. I called him and I said, why not? I mean, what's the obstacle that A.R.C is stopping not to go to Somalia? Knowing that we have the largest Somali Americans in Minnesota, and even in the world, we have the largest Somali Americans compared to the other countries. So he said to me, hey, we can go to Somalia, but these are conditions. If Somali community come partner with us, so we can't go alone. We don't want to go alone, A.R.C itself. And two, if the community can raise funds, I mean 250,000, that he thought of 250,000, and he was challenging me at that time. And then three is, if the Somali diaspora, Somali Americans, can at least go back and help, and don't get, this is about, we are an international humanitarian organization, we don't get involved about religious activities or political activities, so if we focus on. So I listened to him, and then I said, okay, that's a good, we can do that. 250 is nothing to Somali people. The Somali community of generals have been sending millions of dollars to Somalia for the past 20 years. Actually, in 2000, when I came to Minnesota, the Star Tribune, the largest newspaper in Minnesota, wrote an article that Somalia, Minnesota sends $7 million a year. So $7 million compared to 250,000 is a piece of cake for us, and we all know. So I put the three things on the table with you, and I challenge you, and I say, hey, okay, that's good, but here are the challenges. And knowing that our community, if A.R.C wants to go to Somalia, wants to be partnered with the Somali diaspora, they have to be based inside Somalia, no matter where it is, but they have to be based inside Somalia, not in Kenya. You know, a lot of organizations have been in Kenya for the past 20 years, and although they have done something, but they're not as effective as we were expecting. And number two, A.R.C has to be transparent and accountable to the community. So they have to open its doors so anyone can walk into the office to be part of the programs they're doing, whether it's volunteership, whether it's not only giving the money, but also getting into involved, so that they can help. So it should be a channel for the Somali diaspora to go back if they want to go back to Somalia and help. And number three is A.R.C should focus only. They should be focused on only humanitarian, not personal things. That's what we know in Somalia. And it's so sad for the past 20 years. And he accepted that, but he said I can't talk to every member of the community, so I didn't if we can bring in about a few Somalis who can sit down and take the leadership. Because Somali Minnesotans are 100,000, so we can't talk 100. So what I've done is I approached a number of people I knew. Some of them probably Abdullah knows, or Abdullah worked in Minnesota for quite some time. I talked to I talked to 20 people initially, but 11 of them were stick together. The others were said, oh no, this is not gonna, it's impossible. We don't want to go to the time, we don't want to get involved with them. It's taking a lot of time. But 11 of them came together, 5 of them are women, all of them are professional from medical field, some of them are doctors, some of them are nurses, but some of them are married, they're getting to just one other age. So we came together, we started working. The process while we were working, the A.R.C was busy with everything. So that was in 2009. We met with Brian, we talked about it. We sat down with them, we signed it because the group is being called Internal Displaced Somalia Advisory Council. And the focus was only to help the people who are really, Somalis who are really refugee in their country. That's what we call Internal Displaced Somali people. So our focus was that because we know those people have moved from one location, from South Central to other locations. So what we have done, okay, we came together, we signed a memorandum of understanding. But before we do anything, we said, okay, we're a Somali diaspora, we haven't been to Somalia for a very long time. We don't know what's happening with Somalia right now. Therefore, we have to send a team from both A.R.C as well as the advisory council to Somali professionals. So we went to Somalia last year in June 2010. I was one of the people who went to Somalia, and we were in Somaliland briefly at that time. There was an election, so we went to we met some folks from Somaliland, and we went to the Puntland, and we met. What we were doing is our trip was based on assessing number one, is there a need, humanitarian need in Somalia, and B, is it logistically possible? Can we do logistically? And C, is security reliable? Because what we hear in Somalia for the past few years, every time you see the headline of the news, Somalia is the most dangerous place in the world. And when you look at the articles about it, we're talking, every article shows no issue. So we know there are areas that are relatively stable in Somalia, and we can respond to that. So we went there. So we were in Puntland. What we have done is that we met with the local authority as countries build. We met with host community. We met with the people who fled from the southern part of Somalia. And then we met with local NGOs as well as international NGOs working. We want to figure out who's doing what, is there a gap where we can fill it out. And when we came back, we were in Nairobi event, and we met every country director of international organization working in Somalia. And what we find, we were asking questions, what area are they working, what kind of projects are they doing. So when we came back to Minnesota, we sat down and said, yes, we can do humanitarian work in Somalia. Somalia is an area that we can study, other areas that are relatively safe. And we went to actually, when we were in Puntland, we went to Garowe, we went to Bosaso, we went to Galkayo, both southern Gulf, under the new administration, as well as the